Thank you very much, Dr. Govender, for your time. Now, a lot of people, I think, have been wondering, look, I had COVID in March, for instance. I don't have COVID anymore. But here are all these symptoms that just keep staying in my system. Why does this happen?
So I think, globally at the moment, we're still trying to unpack this. Initially, like many doctors like myself, thought that patients that complain of symptoms after the initial infection were just being anxious because of all the media around COVID-19 and all the mortality on media. So recently, I think in February this year, the World Health Organization basically asked international authorities to start looking into the mechanism and also management of long COVID, because a lot of patients have been complaining of, experienced a lot of being very disabled after initial infection, basically complaining of trying to return to a sense of normality in terms of normal day-to-day function, returning back to work, and because of this also, we're seeing a lot of post-COVID depression. So the reason for this, the mechanism, why certain people develop long COVID or post-COVID conditions is still baffling scientists and doctors at the moment. So there's a lot of research being done for us to understand the mechanism. But what we believe is that the reason for this can be due to the direct organ damage or tissue damage from the body's own immune response to the initial viral infection, or it can also be due to the virus itself. So. And also with long COVID, there can also be a lot of other syndromes that we also know of, like post-intensive care syndrome, also post-viral syndrome that we see with other viruses like the Epstein-Barr virus, or even multi-system inflammatory syndrome that we see. So we're still not sure, but as I said, there's a lot of research being done around long COVID, and even currently there's roughly about 5 million people globally that are being currently presenting long COVID. So there's a lot of research being done, and we're still waiting for this. So even if patients even have a negative result, and they say, "Doctor, why am I still having symptoms?" This is because of the direct organ and tissue damage from the initial infection. So to also remember that patients are non-infectious, but because of the long-term damage, these are the reasons why patients are still experiencing symptoms, even weeks, even in some patients, even 9 months after the initial infection.
Yeah. Okay, Doc. So what is your advice as a doctor who sees these patients? What do you tell them in terms of what they need to do to get rid of the symptoms eventually?
So currently there's no test. A lot of people have been doctors, so there's no test to diagnose long COVID. It's basically a diagnosis based on exclusion. I think it's very important for the primary care practitioner, whether it's a doctor or nurse, to take a thorough history, looking at past medical history, current medical history, and also working a treatment plan for the patient. Remember, because the symptoms that persist after initial infection might vary from patient to patient. So your treatment plan is a very multidisciplinary approach. It involves your doctor, your specialist, also your rehab specialist, which includes your physiotherapist and your psychiatrist, your clinical psychologist. So it's a very holistic management, to long COVID, and the reasons. And sometimes patients are, wanting to return to normality, but as I said, it's sometimes and the symptoms can last a few weeks, even to months, and sometimes even can be permanent impairment. Like we see some patients even after, which was one of the common other symptoms, is loss of taste and smell. A lot of patients return the sense of taste and smell after about 4 to 6 weeks, but because of the damage to the olfactory nerve and the olfactory cells, sometimes the loss of taste and smell can be permanent. So it's very important. If you look at global, in first world countries, they are basically looking at long COVID rehab and wellness centers, which we haven't really looked at in our country because we've all been looking at acute management of COVID-19. But now, with the number of cases of long COVID, we need to focus on the long-term management, which is of your wellness and rehab centers. So it's a very difficult thing to manage at the moment because it involves a number of other disciplines and also, patients wanting to return to a sense of normal, to get to normal functioning.
Of course.
And a lot of patients are complaining but being very disabling at the moment. So that's why the World Health Organization in February this year has asked all, international authorities to look at long COVID because of the number of cases that we're seeing now.
All right, Doc, so I'm running out of time. Just very quickly, in terms of the patients that you see, it doesn't look like South Africa is going to reach that 67% herd immunity by December. Our vaccination program is very slow again. We're supposed to vaccinate 200,000 people per day. I think we had 20-odd thousand per day. Have you seen any a growing amount of patients coming to your practice with COVID-19 lately?
So the positivity currently has decreased with the Delta variant. We've seen a decrease in the numbers over the last week or two. But in terms of patients wanting to be vaccinated, I think it's also, patients need to look at the science. I know there's a lot of information there in terms of anti-vaccinators that, a lot of negative media, but we need to look at the science. If we look at the stats that came out from Western Cape in the last month from Curtesy Hospital, looking at vaccinated versus unvaccinated patients, most of the patients that were in ICU that required ventilation were more than 90% of the patients were unvaccinated. Even in my personal practice with the third wave, I think I only had a total of maybe 3 patients that I had to refer to hospital, and they also recovered. And that's the reason behind that is because most of them have been vaccinated. So we're seeing the positive. Even when you're talking about long COVID, there's a study that was done in the UK that showed, patients that were vaccinated, the chances with your chance of developing long COVID decreased up to 50% in vaccinated individuals. So there's a lot of positive. I believe in the science behind the vaccines, and I think it's important to understand that the main reason for the vaccination program for one to be vaccinated is to prevent severe illness and death, and we've seen that in the third wave. So it doesn't prevent you from getting COVID, but if you do get COVID, your symptoms are very minor, and patients tend to recover very well. And then even now, so even with long COVID, if you've been vaccinated, your chances decrease by 50% to experience long COVID. So there's a lot of benefits from the vaccine. I think what's lacking, where we need to push is obviously push the scientific evidence, not people on social media giving their personal opinion on the vaccine, but look at the scientific evidence that's coming out in our country, not looking at stats in the first world country, but looking at stats in developing countries like South Africa, and looking at the positive effect of what we're seeing in vaccinated individuals at the moment. So I think that's very, very positive, and we need to try and get motivated, larger, I think currently we are about 14 or 15% have been vaccinated. And then if you look at the UK and first world countries, they opened up industry, hospitality, and patients and communities, and this country has gone to basically back to a normal sense of, reality and enjoying the benefits of a country being vaccinated, because most of the first world countries, I think about 80% of the population is vaccinated. So
definitely,
if we want to enjoy a similar type of normality,
we could learn a lot, Doc, from those developed countries. I have run out of time, but thank you so much for all the explanation, and thank you for taking time to speak to us here on ENCA.